Hi, my name is Olivia Sanders, and today I'm going to be presenting my thesis proposal titled The Effects of Resistance Wheel Running in a Murine Model of Rhabdomyosarcoma Survivorship. So to start off with a little bit of background information on rhabdomyosarcoma, it is soft tissue cancer where the tumor resides intramuscularly, so it's often found in locations such as the head, neck, and extremities, and it's actually the most common soft tissue cancer found in children. It comprises roughly 5% of all pediatric cases. So, part of what has contributed to the remarkably high survival rate of childhood RMS is breakthroughs in therapy, and usually a combination of chemo and radiation therapy is used. But these therapies can actually lead to negative long term side effects, such as an increase in reactive oxygen species, DNA damage, and importantly, cell death in normal tissue because they are so systemic in their nature of the treatments. Because this cancer affects primarily children, it's extremely important to consider the long-term effects this will have after the cancer has been resolved. So not only has it been shown that survivors have a reduction in quality of life, but they're also at risk for more frequent hospitalizations and more likely to develop future chronic health conditions. They've also been shown to have significantly reduced exercise capacity, and they have been shown to have a reduction in peripheral muscular strength, which results in a reduction in motor control. Finally, radiation has been shown to result in increased intramuscular fibrosis, and in fact, radiation-induced fibrosis affects up to 80% of all irradiated oncological patients. Satellite cells specifically play a critical role in the regeneration and development of new muscle fibers. So they have the capacity to either differentiate and generate these new muscle fibers or self-renew and maintain the satellite cell pool through the progression of their cycle of quiescence, activation, proliferation, and differentiation. But another cell type of population called fibroadipogenic progenitor cells, or FAPs, are a crucial player in the regulation of the satellite cell niche. So they indirectly influence the repair and formation of these new myofibers by creating a favorable microenvironment for satellite cells to progress through their cycle. FAPs can either follow adipogenic or fibrogenic lineages, but the interesting thing about FAPs is that they're a double-edged sword when it comes to muscle homeostasis, because overproduction and improper clearance of FAPs can lead to collagen deposition and therefore impaired muscle function. So physical exercise has recently emerged as a potential treatment for cancer-associated muscular dysfunction since it has the unique ability to stimulate these satellite cells to proliferate and differentiate. So recent studies have actually further revealed that exercise may play an essential role in FAP regulation as well. And in fact, injection of FAPs into the hind limbs of exercise mice has resulted in an indirect increase in muscle fiber number as well as satellite cell activation. Furthermore, they've also been shown to increase myonuclei and an increase in myofiber size. So the current gap in the research right now is that there are currently no studies that have examined the long-term muscular defects that are associated with early age RMS treatment and what type of influence resistance exercise can have on mitigating or reversing these negative effects. So the purpose behind this current study is to determine the role that resistance exercise training has on reversing these long-term negative consequences of both RMS and chemotherapy-induced muscle dysregulation. So what we hypothesize will happen is that exercise training is going to result in increased muscle function outcomes as a result of measuring a host of dependent variables such as muscle fiber cross-sectional area, myonuclei per fiber, satellite cell number, intramuscular fibrosis and collagen content, as well as endurance and grip strength. Electrical stimulation and synergistic ablation are among the few preclinical models of resistance exercise training that have been used in recent years. And even though these methods can produce a significant level of hypertrophy within a rather short period of time, they have many drawbacks that make them ungeneralizable, especially to humans. So first off, they are extremely invasive, and because they're a permanent solution, they're continuous in nature, so we can't examine a detraining effect because they are irreversible. And finally, when other weighted wheel methods were used, there was no real way to change the weight, and often this would discourage the mice from continuing with exercise. So that's where the progressive weighted wheel running or power protocol comes in, because it circumvents a lot of the issues that were previously talked about. So resistance in the form of magnets are going to be placed on the running wheel and increased over an 8-week time frame, and this procedure has actually been shown in the past to elicit significant muscular hypertrophy and cause an increase in myonuclear and satellite cell density. So the reason that this is so important is because it allows for reversibility, and because it is episodic in nature, that better reflects human resistance exercise training. And as previously mentioned, although other weighted wheel running exercise protocols have been tested, the wheel resistance loading was too heavy for mice to run at a maintainable pace, and this ultimately discouraged their sustained exercise. So the adjustable resistance and unbalanced wheel that's facilitated by the addition of these magnets in our design is that it circumvents these issues. So 44-week-old mice will be randomly assigned into either the sedentary or resistance exercise trained group, and then they will receive the Rhabdomyosarcoma cell line tumor injection into their right gastrocnemius. 3 days post-tumor injection, they will receive the injection of the chemotherapy drug vincristine, and then 2 days after the chemotherapy, they will get 5 doses of 4.8 grays of radiation therapy, and then the resistance exercise group will go through the power protocol, while the sedentary group will be housed with a sham wheel. So we are hoping that these preclinical findings will provide rationale for the investigation of resistance exercise training interventions in childhood sarcoma survivors in order to preserve normal skeletal muscle development. So these are my references, and at this time, I would be happy to field any questions you may have for me.